Inside Your Mind, the BCPA Podcast.
Welcome to Inside Your Mind, the BCPA new podcast series. This is our very first episode, and I'm very happy to have two guests with me who I already know or known before, and I appreciate as colleagues. So that part's going to be very easy. Myself, my name is Wolfgang Linden. I am retired from 36 years at UBC, and I've done lots and lots of work with college and the association. And so that's how I kind of end up in the role of hosting the first of the series. Exciting. Let's hope we can do this all very well. And so I'll do a very brief introduction. So Dr. Leung is director of the Wise Mind Clinic and has been in practice for quite a while. And actually, we've known each other for a long time. And the clinic takes mostly teens and adults. And I know you've also worked in a lot of other environments, teaching courses, providing supervision. They're really doing all the things that psychologists are trained to do, and not just be locked in a private practice office, but spread the word and share the skills. Yeah.
Yes. Thank you for having me.
We represent different groups. I mean, I'm the one with the white hair, so Dr. Elterman is the youngest of the crew, and I'll tease a little bit about that as we go along, because we may have adopted different perspectives as a function of what age group where we are or how many experiences we've gathered. So he's done quite a bit of different work, both in clinics since graduation, and is also now doing custody and access work, which is quite a challenging additional field. And I can relate to that for reasons I will not greatly expand at this point. In any case, so this is our crew. The purpose of the podcast, of course, is not just to share information, to share facts, but it's important that we have real people and they have opinions and views. And so I'm going to do two things that weren't pre-planned, but we got to have a little bit of action here that way. And that is to really introduce ourselves in more personal ways. So the first thing I'm going to do is I'm going to ask you something to our audience that has nothing to do with psychology, but that's very typical, very idiosyncratic of you. I'll give you an example, in all fairness. That is, I am somewhat ambidextrous, which occasionally is a good thing, but I cannot throw a ball or play golf. All I do is I make people laugh when I try. Do you have something similar you can share? This just to give us a bit of a sense of you.
Okay. So I could share that, well, I'm a mom of two, which is very important to me and my identity. And I have twins, and they're both 16. And I often say things that they find embarrassing in front of their friends. That's
Mom, you embarrass me.
Yeah, it's like, Mom, why do you do that?
But the difference is you hear it in stereo, right? Where most parents hear it just kind of in one direction, you hear it all around all the time, right? You're from both directions.
Yeah, absolutely. Like two, and they just like coordinate with their complaints.
So similar.
I feel like, when you're in front of the class and they ask you to say something about yourself and you freeze up and you go, I'm not special. I'm not. Well, like we were talking before the podcast, I also have a child. I have a 1-year-old boy, and when you have kids for the first year, I think a lot of stuff just gets compressed and you don't do a lot of things that used to do. Something about me, I don't know. I think really just anything that makes me uniquely myself is The best things that I have are my kid and my family and all those things. And I don't really do much else because once you have a kid, I don't think anything else really seems very super important. I'm not ambidextrous. Yeah, I'm not ambidextrous. So I don't, as soon as I think of something special or unique or important about myself, I'll let you know and I'll disrupt the conversation. How's that?
I won't give a model, although I will answer it myself if you want me to. And then I'll start with you, Sam. Thinking back, is there one particular book that's been most influential in making you want to be a psychologist, or how you are a psychologist, or a person who's been driving this in particular? And if so, what was it? What's the message that you've taken away from them or it?
Were you going to answer first, or did you want me to answer first?
Ooh, I don't want to hear the answer.
I think the one that I can think of that was the earliest was On the Road by Jack Kerouac, and I think that book was the first one that kind of told me about the realities of you can actually have an adventure as a real human being outside of fantasy, right? You don't have to be in Lord of the Rings or in Harry Potter or whatever, because that was my generation grew up with fiction that was very fantastical and stuff like that. But reading things like On the Road or Dharma Bums or those kind of things from the Beat Poets were the first kind of examples to me that you could go out and kind of have an interesting experience. If you're talking about things that inform my clinical practice that aren't just textbooks, Man's Search for Meaning is a very classic one. I think about that one a lot. I had the great opportunity to give a speech when I graduated, and I just stole from that because it's just the best in terms of the way that I do things. Yeah.
I can't really remember a book that I read early in my career or life that informed it. Yeah, yes, but definitely they're more kind of mindfulness kind of based book, like When Things Fall Apart by Pamela Trojan. And there's also another book that I really was impressed with. It's called Happiness, something about like understanding the nature of mind by, I only remember his first name is Matthew, and he's French, I think. And he's a monk, but also trained as a neuroscientist, but I forgot his name.
But when did you read that?
I think I was actually in graduate school. Yeah, I read both, or in my postdoc training somewhere along in that last few years of my training.
The lens shift happened.
Yeah, no, it just helped me kind of build, like, kind of understand more about what I've learned in books and add to my understanding of, like the nature of, human and thinking and psychology and suffering and pain.
Oh, wow.
And how they're related to our thoughts in some ways, right?
That's really cool.
Yeah.
Okay.
Thank you.
We have a specific topic today, of course, and that is, what is a psychologist? And for starters, I'm sure we all agree that any psychologist can answer that question. But I think the really interesting part for the audience is to listen carefully to us and wonder about, are they going to give me the same answers? If I asked 1,000 of them, would they give you the same story? So I want to alert the audience to carefully listen to all of us and see whether we are telling the same story or are we that different? And so the number of sample questions that we have and then can easily be asked, but I thought one would be an interesting one to start with, and that is when we finish today. What is it that you would like the audience to take away from this conversation? Because it's easy to drown people in information, right? If somebody gives a talk, you can't leave 16 messages at the end. 1, 2, 3, and that's it. That's as much as people can remember.
I think that there are quite a bit of confusion or misunderstanding about what a psychologist does compared to other type of mental health professionals. And even when I talk to, I talk about psychology quite a bit with my own family, my siblings and stuff like that, but they don't really know exactly what I do and how I'm different from other mental health professionals. So, and if we could clarify some of the misconceptions and give our audience a bit more understanding about what we do, I think that to me, I feel like it's mission accomplished.
Well, and I think on top of that, looking at psychologists have a very specific kind of training that does overlap with other people who we're going to talk about, right? I assume we're going to talk about psychiatrists and psychologists and counselors and social workers. And there are things that we all do that overlap in a certain way, but we all have different trainings and specializations that on a case-by-case basis, you could go to a different person. It's not just, it isn't a hierarchy, that we all kind of have a different skill set that has a purpose in different areas, right? And for psychologists, a lot of that is, especially in BC, it's around assessment, right? Assessment has been more so psychologists, and also in different specializations. Like, I'm sure you're going to talk about what you do at your clinic, but we also are really good at being highly trained in certain niches of types of therapy or certain types of disorders.
So, I mean, when anybody asks you who has mental health issues and says, well, I have such and such a problem, should I see a psychologist or a psychiatrist, social worker, whatever? But what kinds of problems would you send them to the psychologist?
I would want to know like what kind of things they're struggling with and what they have tried, right? And what worked for them and what didn't help, like if they have already access help. And for, some people might just want to have someone to talk to and just like kind of their day-to-day, week-to-week challenges, and have someone listen to and give them some suggestions and take on a try. I think that they could try, maybe like they don't have to go with a psychologist at the beginning as a first try. But for more complicated problems, or they have already sought some treatment and it didn't seem to be working for them and they feel like they're stuck. And I think that maybe talking to a psychologist who could get a good assessment, a solid assessment, could be quite helpful. And that's not what psychologists are trained to do, and we're good at doing that. And then there could be different treatment options, and then I think the individual could kind of consider the different options, the pros and cons of it, right?
So add some more, flesh it out.
Yeah. So the question is, if someone comes to you and they're saying, I'm having some problems, who should I see? Yeah, it's going to depend on the problem. If they come to you with issues that need medication, I say, okay, well, psychologists, we don't prescribe in BC, but your GP or your GP, your family doctor, or a psychiatrist would be a good route if you do need medication. If you are in need of, like Debbie, you said, more day-to-day stuff. I mean, psychologists, we can do that, but you could probably go to a counselor, especially if fees are an issue, right? A lot of questions that I answer are also around fees, right? So MSP covers psychiatry, and a lot of insurance covers psychology only, and some insurance covers psychology and counseling. So a lot of it has to do with what is available to you, what kind of issues are you having, and what do you actually need? And even if someone says, I need a psychologist, is that a forensic psychologist? Is that a neuropsychologist? Is that a clinical psychologist? If they're a business owner, do they need an organizational psychologist, right? So there's so many things that we also do outside of clinical psychology. It makes it a very difficult question, right? People forget about that.
Let me put a little stimulus out just to keep the discussion going. It's a great article many, many years ago. I think it appeared in American Psychologist about the degree to which taxi drivers, hairdressers, and bartenders are natural therapists. Have you read it? Do you know?
Yes.
I haven't read it, but it makes sense. Yeah.
Well, the reason, of course, that they picked those people are captive. To some degree, they might be under the influence.
Hopefully not at your barber's.
And hopefully not at the barber's. Yeah. And so they talk. And I mean, I was a taxi driver as well when I was a student. So I had lots of conversations like this. So what do we have to offer that the bartenders and the taxi drivers and hairdressers don't have?
That's a great question.
That is a great question.
It makes me think of, what is evidence-based therapy, right? Because the difference between someone who doesn't have training and someone who does is the person who has training uses evidence-based therapy. And even if we talk about evidence-based therapy, it doesn't mean, well, here is something that works for everyone. It is, here is the thing that we know that is safe and also works for the most amount of people. So I would say evidence-based therapy. And what that means is something that has a really good case conceptualization, like you were saying, Debbie, which is, do we have a reasonably good explanation for something that is actually quite abstract, right? If I say, where is your depression on your body? Where is it in your brain? Where is your anxiety in your body or your PTSD in your body? There's no place, right? So we have to have this place of structure on something that doesn't have structure. And if you're talking about clinical psychology or assessment, what we do really well is put a structure on stuff in order to help people. So we know, sharing a burden halves the burden, or something like, if you talk to someone, you have your burden, right? You can talk to someone, you feel better. But in terms of actually helping problem solve what's going on, I think that's where a psychologist would do better than your average. I wouldn't say every taxi driver, because I've never been in a taxi with Wolfgang, but I'd say better than, we would hit the target more often than your average taxi driver.
I can't agree more. I totally agree with what Simon just said. And there are things that we could just kind of get it off our chest by talking to someone, whether it's a friend, a neighbor, or a taxi driver, or your hairdresser. But I think that I don't know, if there's something that you want to change in your life and you want to change to be, consistent and solid and ongoing, right? And I think that in the long term, then I think talking to someone like a psychologist I think the psychologists are really well trained in the case conceptualization, like what Simon is saying. And now, of course, different psychologists, depending on our training background, we may look at problems and change, or what needs to take in order for change to happen very differently, right? And but I would say most psychologists, we're trained to look at problems, issues in a systematic way from a certain framework, right? So I have come up from a very cognitive behavioral background. So I look at, patterns of behavior over time by doing a lot of assessment of behaviors that happen in certain moments, and then I come up with my conclusion. And so by doing that kind of assessment, it help my client figure out, what are things what are the things that are contributing to the development of the behavior, and also maybe more importantly, what are some of the things that are happening that are maintaining the behaviors that are getting in the way of the client wanting to make the change on their own. And certainly go ahead and try, right? But if you run into difficulties by just talking to a taxi driver or doing it on your own, then I think having a psychologist, someone who's trained with different, solid training in case conceptualization, to try to tease apart, some of these factors I think it could go a long way. It could be really helpful.
And it's interesting, because I was thinking on the drive over about what is a psychologist, and how an actual psychologist would be the worst person to ask, because we would talk about it for an hour. But I think there's a degree of, and I know this isn't the right word, but I think there's a degree of pedigree, right, in terms of where the profession of psychology came from. Because as Debbie, as you're talking about it, I go, okay, so what you're talking about is a very psychologist thing to do. How are you and a neuropsychologist and an organizational psychologist and an assessment psychologist, we all get the same baseline training? How is it the same profession? And I think it comes from a really high standard of academic rigor in research. That is the similarity that kind of pulls across. There's a historical split. I think it was in like the late 1800s, early 1920s, where, psychologists and psychiatrists split off, right? And then you had counselors and social workers a little bit later. but the difference between the two became psychologists coming out of a more research academic background, whereas psychiatrists were more in the medical field. They were more in the hospitals. They had more of this kind of clinical training. And it's interesting because I think that is a lot of the professional identity that we have as psychologists, is that we know how to do the research. Like, everyone knows how to do the research. We know how to consume the research. There's actually something called I think it's the Boulder model that we all learned about, which is there's a whole model of psychology that we need to be scientists and practitioners. And so I think that is where, to answer your question, we come from a very kind of specific standpoint of, I'm going to take as much scientific information and integrate it. Whereas I think the differing people that we might talk about, yes, they rely on the science, but we're the dorks, I think, in the situation. Yeah.
People go to a psychologist. Obviously, there's a threshold here of discomfort of doing this and opening up to somebody else. What would you tell the general audience what to expect? How quickly can you see change? How likely are you going to see improvement?
There's interesting research on that, which is the earliest measurable change that you can feel relief is before you see the psychologist, right? Is when you make the decision that you're going to get help, is when people start to feel better, right? So even in the decision to go, I think I need help, I need to call someone, that's when people start feeling the relief, and it only kind of gets better from there, right? So when people are making that decision to go, I'm thinking about seeing a psychologist, what can I expect? I don't know. Maybe you have a different answer, but I think I say, you've already made the hardest decision, right? Which is to get help and to do that. I kind of frame it in a way to people, and I say, remember, you're the consumer, right? You need to call a bunch of different people and see who you get along with and who seems to have a good idea of what's going on in your life. I tell people to shop around because they're the consumer. And I think that helps people relax because they feel as though they have to look at people's profiles and look up their theoretical orientations and do all this, and they have to commit. But really, just to remind people, call 4, 5, 6 people, see who seems to understand you the best. I think that takes the pressure off of people to pick the right psychologist. Yeah.
I think it also depends on the complexity and persistence of the problem that you're seeking help with, right? And most people, like if they're getting evidence-based treatment like cognitive behavioral therapy, I would and for issues like depression and anxiety, I think, if you have regular sessions, maybe like 12 sessions or, 16 sessions, in the ballpark, that could, you may, by the end of therapy, you would start noticing some changes. But for more complicated problems, a lot of trauma, right? Trauma-related problems, a lot of interpersonal difficulties and concurrent problems, disorders, and it could take longer time. One thing that I tend to, at the beginning of therapy, when the first couple of sessions, we're trying out whether to figure out whether the client and myself would be a good fit, is to talk about based on my initial assessment, my impressions, and what kind of treatment they need, right? And this is what I do. This is my approach, and it might take about this many sessions and how frequently. And I think that's a very important kind of conversation to have at the beginning when you meet with some psychologist. And yeah, and I think that psychologists, the other thing that we tend to do is we assign homework, and well, depending on your theoretical orientation, definitely. But for most, CBT or, I do a lot of DBT work too. And we track progress and we assign homework. And I think that a lot of actually therapy has to happen in between sessions, because you only come, I often tell people, I only see you one an hour, right? At the most, right? Yeah. Or even if you're in a DBT program, you're doing like 3 hours a week. And how many hours are there, right? And so, you could be sitting here in my office and nodding your head and say, yeah, 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 Dr. Leung, you're like, this is right. And, I'm going to do it. But the magic actually happens in between sessions. So you've got to put in the work. And I also, yeah, you've got to put in the work, and then, and it could be challenging sometimes, and that's okay too, right? So it doesn't fail you. It doesn't mean that you're not a good client, not patient, right? So the idea is not to be the perfect patient, but actually work with your therapist, work with your psychologist to figure out, okay, well, how come you didn't do the work, right? And what can we do to help you actually do the work so that we could generalize the skills in between your sessions?
So you're really, making the point, which I totally agree with, that it's really important to have the right kind of match, right?
Yeah.
So question, a very pragmatic one, both from a psychologist's perspective as well as a client's perspective. Is it a good idea to have like sample sessions? You offer like a half-hour first contact. Should we recommend to the public that if you want to choose a psychologist, treat it like a car purchase? Test drive 3 cars, see what they feel like. Sit, talk to 3 psychologists and see who feels right. You think that's a good strategy, first of all, for psychologists to offer it, and secondly, for clients to take it up and try it out?
Well, I don't know about you, Simon, but I think that a lot of psychologists offer initial free consult, like, usually 15, 20 minutes. And if the psychologist I think that once you make the decision that I'm going to go seek, help and talk to someone, you do your research, and then if the person offers like a consult, right, initial consult without charge, and I think a lot of psychologists do offer that, take advantage of that. I don't know if shopping around is a good idea too. I think like get some consult with a few psychologists at the beginning to find a match, just to try to increase that fit would be helpful. I always tell people that therapy is hard work, right? Especially we're talking about things that you really try to change, and there's trauma history, and even changing the way you respond to other people, right? Who are not always very pleasant and reinforcing. They could be hostile. They could be like really upsetting you. But to build a life that is worth living for you, or, fit your values and your long-term goals, you have to change those behaviors, and it's hard work. And if they have the expectation that, meeting with a psychologist, just show up and chat and it's easy and I feel good every time, then I think they're more likely to quit.
I would like to contradict myself because I think that's an excellent answer. And I also, before, when you were asking the question, should people shop around? I said, hell yeah. Like, you should be in charge of your own healthcare. You should be able to advocate for yourself. And then I thought of all the exceptions to the rule. Oh no, I'm going to get in trouble. So I think when it comes to therapy, I think it is good to a certain extent to talk to a bunch of people. We know that therapeutic alliance is really important. So how well you get along with your therapist is really good. But like we said before, we're not just talking about clinical psychology, we're also talking about assessment and all that kind of stuff. Something people often call me and they say, hey, I need a psychologist. And then I go, okay, press 1 for this, press 2 for that.
I have a cartoon for that.
Yeah, exactly. Right. And so because I do assessment and I also do therapy, there are certain things that I tell people before we get into this. There are things that I shouldn't know. So if people are listening and they're interested in finding a psychologist, if you're looking for therapy, call a psychologist, say, here are the issues that I'm having problems with. Here's how I would like some help. And we've thrown around this word theoretic orientation quite a lot, but to someone who doesn't know what that means, when we were speaking before about placing a certain structure onto something that is abstract, like depression or anxiety or whatever, theoretical orientation is basically there are different ways of organizing that structure, and that's what we call theoretical orientation. So some words that we use are CBT, psychodynamic, DBT, ACT. So that's what we're talking about. When it comes to assessment, people say, hey, I need an assessment for ICBC or for a civil case or for a family law case or for a forensic case. And in each of those issues, sometimes I say, okay, tell me about it. And in other issues, I say, you can't tell me anything about this, right? What is worth noting is that our role is very different in assessment and therapy in terms of being unbiased versus biased, right? So if you come to me for an assessment, I'm not a hired gun, right? I'm not someone who can come in and you go, hey, I have PTSD. I need that. And I'm going to, I need this for court for my work because they gave me PTSD, or maybe I've done a few for people who are immigrants who are claiming asylum. They say they have PTSD from their previous country, and if they went back, it would be bad. And that's fine, except I might not find that this person has PTSD. My role isn't to say, yes, you have PTSD. My role is to go, I am unbiased. And based on these unbiased methodologies that I've used, it doesn't look like you have PTSD, or it doesn't look like you have depression. It's actually might be something else, right? And then you get to another layer where when you get into not just assessment, but you get into, let's say, parenting issues, right? Like you're saying, custody and access, parenting. I think often they're being called parenting plan evaluations now, right? Parenting capacity. People start telling me about it, and I say, hey, I'm supposed to be, if I'm evaluating a whole system, right, with two parents and one or two kids or whatever, and one person comes to me and they tell me their whole story, then I'm biased, right? Because I'm supposed to be biased in therapy, but I'm supposed to be unbiased in all assessment. So when people come to me for these family law things, I say, stop. Because if I'm cross-examined by the other side and they say, is it true that the other side called you before you started the assessment and biased you to their side, and that's why you're taking their side, then I'm going to be in hot water. So the question that you initially asked, which is, what would you tell someone who says, I'm looking for a psychologist? I'd say, like you said, what is the issue? What are you looking for? And depending on that, I'd give them if it's therapy, yeah, tell them what you need, what experience you've had. If it's assessment, tell them what assessment you need, and then if they say, okay, tell me more, then you tell them more, because otherwise you don't want ICBC to come after them or WorkSafe and say, hey, isn't it true that
I think
isn't it true that you have 100%
you can't switch hats.
Exactly.
You start being an assessor, that's it. You can't become the therapist, and vice versa.
I thought it was you can go from unbiased to biased, but you can't go from biased to unbiased.
It's clearly that. Yeah. I mean, you could potentially go from assessment to treatment, but not the reverse anymore.
Not the
when
reverse,
the shop's
yeah.
closed.
Yeah, and absolutely. I think that this is a misconception that people have, right? Like, so they want to, there's like a goal, right? They want to get insurance coverage and it makes sense, right? They want to do that. But then they are going to a psychologist looking for assessment to confirm a diagnosis. And I have told people I can't confirm a diagnosis. I have to do my own assessment. Yeah.
And, you hand them the report. They paid for this report. It's taken a lot of time, and it says, okay, this says that you're not really experiencing this, right?
But different tech. Think of me as your grandfather. I dropped out of school because I got a great job as a 14-year-old in the sawmill. These jobs existed at some point in BC, and they were paying well, so people did quite okay. It doesn't work anymore, but anyway, so, I'm a reasonably intelligent person, but not very educated. It's a family reunion, and both of you have told me that you want to be psychologists. And I said, well, I hear all about psychiatrists and social work and psychologists, and what's the difference? What are you going to tell Grandpa?
Where my mind goes is, listen, I have this infographic, and BCPA has worked a lot for this infographic. So I would say BCPA has some great resources, and I would explain there's different areas of practice, right? There are and that's another misperception that people have, is that psychiatry and psychology both go to med school. Psychiatrists go to med school, right? Psychologists, we have our own training pipeline, right? Social workers have their own training pipeline. Counselors have their own training pipeline, right? And it's not just level of education, it's scope of practice, right? So a psychiatrist has med school. The majority of psychologists in BC have a doctorate, right? Either a PhD or a PsyD. Most social workers, if they're an MSW, they have a master's, right? And counselors aren't regulated yet in British Columbia, but they will be, I think, in the next 2 years, and we don't know what that's going to look like. And so what kind of problem you're having is going to differentiate what professional you go to. But a psychiatrist could technically do, I think I've seen some psychiatrists who do custody and or parenting plan assessments, right? I've also seen counselors who do parenting plan assessments and social workers who do parenting plan assessments. Some social workers can diagnose, counselors can't diagnose. It becomes complicated with what is a protected term, what is a protected activity, because that's also changing a lot in BC. In some places in the States, a psychologist can prescribe things, right? So I know I'm confusing Grandpa, but
Yes.
but Grandpa needs to ask clear questions. But
So why don't you become a doctor? They earn well.
They do earn well, right? But Grandpa, it all depends on what you're interested in. If you're looking at what you want to be, if that's a question, I think whether you're a psychologist or social worker or a psychiatrist or a counselor, you're going to start with Psych 101, right? I think even most people who go to undergrad who do other stuff take Psych 101. It's such a foundational course to take for anybody, right? Sorry, Grandpa. What's interesting, it's another point of complication, which is it depends where the person is working, right? So if you look at the difference between a psychiatrist and a psychologist, yes, there are some things, for example, a psychologist, unless it is legally mandated, a psychologist isn't going to be prescribing medications. But a psychologist, let's say in a rural setting, right? A lot of my internships were all over Oregon and Washington, and I was in rural settings where there weren't a lot of resources, right? And I was in primary care where I couldn't be the resource. And so I had to do a lot of resource management, and I had to take on more of a social work role in that sense. And I also know that there are places where a social worker or a counselor, and not necessarily a counselor because that's a different profession, but where a social worker maybe has to take on less of that part of their role and more of a psychologist role in terms of they just have to do straight therapy or assessment because that's what that area geographically needs, right? And I think a lot of, for example, in BC in particular, because a lot of psychiatry is concentrated in hospitals and academic settings, psychology had to then become the go-to people for assessment in other settings, such as in the court system or in school settings or in insurance or these other settings. And so I think really the difference between the professions evolves over time depending on the location and what the needs of the population are. Yeah.
Yeah. But going back to Grandpa's question, I think that most counselors I think all counselors in BC, I would assume that they have a master's degree in order to get that title.
I think it may be true now, but there certainly was a time where people with bachelor's degrees could become members of the BC Counselor Association.
Okay.
So that's another thing for people to confuse them, which is right now, counseling is not regulated in British Columbia. The government is set to regulate the practice of psychotherapy in 2027. We still don't know exactly what that means. Right now, the largest regulator, the largest organization that gives people the ability to do counseling is the BCACC, right? The BC Association of Clinical Counselors. Right now, I believe they're a private corporation, right? They're not regulated by the government. But there are other ones. There are, if you go on Psychology Today, that's a big kind of directory of people. You see people have different certifications that are Canada-wide. You have different certifications that are BC-wide. So I don't know if most counselors, it's not a protected term, right? And by protected term, we mean I can't call myself a psychiatrist because I haven't had that training. I don't have that certification. Not anyone can call themselves a psychologist unless you're registered with the BC. I forget what our new college's name is. But the College of Health and Care Professionals, the BC College, yeah. And we just got a new college like last year. But right now, counselor isn't a protected term, right? So technically, anyone, it's kind of like life coach in that sense, where anyone can call themselves a life coach or a counselor. But if they have something like, but I am a member of BCACC, then you could go, well, at least I know that they have a master's degree. I know that they have a certain amount of hours of practice and that kind of thing.
Yeah. Yeah. Therapists too, right? People use that term very, generous.
Psychotherapist. What is it in Ontario that they do regulate psychotherapy in Ontario, don't they?
But I mean, in a related fashion, I do want to encourage you to make a case for why do you want to bother getting registered or licensed as a psychologist, which costs you time and money and effort and a fairly high training standard, when you could be a counselor. And what is in it for you as a psychologist, and what is in it for clients?
There's a really funny video that my brother, actually, that's my unique fact about myself. My brother and my father are both also psychologists. And so you can imagine how nightmarish dinner conversations were growing up. Like, I know you're lying. Talk to your mother about that or whatever.
Is that the cartoon on So You Want to Go to Graduate School? Have you seen that one?
Yes, exactly.
That is fantastic.
It's a fantastic cartoon
somewhere.
Yeah, so it's a cartoon of someone who's going to their professor. I think they're an undergrad or something, and they're like, I want to be a doctor. I want to be a psychologist like you. And they say, why do you want to be a psychologist? Say, yeah. And I say, well, I want people to respect me. And the person goes, nobody's going to respect you. Well, I want to make lots of money. Well, if you take on a bunch of student debt, you're not going to make a lot of money. I want to do that. And it's just, the reason has to be that you want to do it, right? And like we were saying before, there isn't a hierarchy where psychology, psychiatry, counseling it's not a hierarchy of one is better than the other. If you love doing therapy and counseling, be a counselor. It's an amazing job. There's some incredible counselors. It's really fulfilling. It's a great career pathway. If you love research, then psychology is probably a better bet because we do a ton of research. Or if you want to do assessment, if you love being able to meet someone and be able to solve the puzzle of what's going on with this person and can I help them out by figuring them out, then psychology might be a great avenue for you. If you love medicine and you love the interaction of biology and psychology and being human and knowing how those things interact, then psychiatry might be a great match for you. So it really is an arbitrary difference. It's just, what do you love doing? Do you just love helping people live better, right? There's a lot of people say the best way to help people's mental health is to give them food, a place to live, a job, purpose, meaning, all of those kind of things. And that's where social work comes in, right? So we're not unique or special. It's just, this is what we love to do. And this is what we're really good at.
But if a neighbor asks me, who should I see? I will definitely send you to somebody who's got a license to practice, because if they screw up, they've got something to lose. And you can actually complain to somebody. So make a big point out of that one.
Yeah, absolutely. The mandate is to protect the public. So we have the BC Psychological Association, right? And it's an advocacy organization for psychologists. But the College of Health and Care Professionals, BC, their mandate is to protect the public. So it's great that we have a regulatory bodies, and so accessing service from professions that is regulated, there's accountability, right? And if something, it's just like if you work with contractors or plumbers, you want to work with someone who's licensed, and we're not dealing with money here. We're dealing with like a lot of pain and suffering. If you need to seek services, and chances are you're struggling, and you do not want to end up working with someone who could actually create more pain and suffering and make the situation worse for you, right?
And I think what this highlights is, within every profession, there's a range of good and bad people, right? You have really bad counselors and really great counselors. You have really bad social workers and really great social workers. Or there are psychologists who maybe make bad decisions. There are psychologists who don't keep up on their training, and that is the reality of being a human being. Is despite really a good amount of training, that there's a different ability levels, but having a college keeps you in check, right? And so not saying that having a college makes you a better psychologist, but having a college makes sure that you meet those minimum standards.
Yeah. And one thing that I think that I'm being proud of, like being a psychologist, is my training and my how much I prioritize ethical care, right? Like, always like, consulting my colleagues about the ethics aspect of like cases and having following ethical codes. And I see that, and then it just even my own reflections, I always kind of look at, what does ethical care means, right? What can I do to approach this and talk to a client and to help in a way that would minimize harm, right? And the ethics piece is very, very important. And if you're not regulated,
ties in with values that we have, right? Actually, I have one question. I think we should probably come to a close relatively soon. But both of you have trained in Canada and practiced, and in the U.S. I've also trained in multiple countries. I mean, if you look at the news, the political systems or the political climate is vastly different between Canada and the U.S., for example. But do you think there's a difference in how we look at psychology and the care we provide to patients? My hunch is no. I think I've seen the same values that shared across the environments I've worked in. I don't know. How do you see that?
I mean, again, with values, this ties into, I think, something that Debbie was saying, which is one thing that I do every year is I help my, it's called alma mater. I don't know Latin, but the old school I went to, but my grad, super high educated, that old school I went to. I graduated from Pacific University with my doctoral degree, and every year I help the class that's going into internship interview. I do practice interviews with them, right, to help them kind of prepare for internship. And what's interesting is that they have less structure around ethics than we do, right? Because often the questions that they struggle with the most are ethical dilemmas. And I don't think that they have poor ethics or anything like that, but I don't think that they're taught necessarily in the same linear fashion that we are. And so what I tell them is, the Canadian Psychological Association actually has instructions and guidelines for how to step-by-step solve an ethical issue that you have, right? And I think that's kind of what you were talking about of, when I have an ethical issue, I kind of go through all these different...
Our college has an ethic code.
Yeah, we have an ethical code, but even just the emphasis on, if something comes up, we have a really good structure for discussing with colleagues, looking at the stakeholder, and we have a step-by-step guide. And when I tell the grad students about that, they go, "Oh, it just makes it so much easier."
A unique benefit. And when I've taught clinical psychology, I teach undergraduates how to do the 10 steps in the CPA code, and it's so helpful.
Another thing too, and Debbie, where did you do your practice in the States? Because I think also geographically it changes.
I did my graduate school in Stony Brook, but I also worked at University of Washington.
In Toronto at the
I went to CAMH, yeah, for internship.
Right. So you're on the East Coast. So I think there's also a big difference in where you are, because when I did my grad school in Portland and Seattle, I think that living in Portland, there was a lot more politics seeped into the program, right? Because it was a lot more in everyday life than in Canada. I think there's less of an emphasis on politics running everything in your life. So I think a lot of the work that I learned about, or a lot of the things that I did in grad school, had a lot more of a political lean than we have as psychologists here.
So a little wrap-up question. Should we keep doing what we do with our ethics training?
What do you think?
Like, should we keep doing what we're doing with all the ethics training?
Yeah.
Oh, absolutely. Absolutely. It's almost like my compass kind of think of issues that we work with, clients that we work with from that frame, the ethical, what would be the highest ethical care that we could provide. And it's important to consult other colleagues, right? And continue to get training in that area.
Great.
Yeah.
I think we should bring it to a close. Thank you very much for being here and sharing with us your views.
Thank you for having
Yeah,
me.
thanks for
Thank
having
you
me
for
too.
having us.
Yeah.
Yeah.
Inside Your Mind, the BCPA Podcast.